Welcome to the Deep Dive. I'm Susan.
And I'm Dr. Greycoat. Hi, everyone.
Today, we're digging into something pretty interesting from our work, melatonin for cats dealing with chronic kidney disease.
Right, but maybe not in the way you'd first think. We're not really focusing on sleep here.
No, definitely not sleep. We're looking at its potential role in helping with anemia, which is, well, a really common and serious issue in these cats.
Exactly. We've been compiling clinical feedback, observations really, from vets using melatonin with feline kidney patients. And some of the feedback was, frankly, quite surprising.
So our goal today is to unpack what we at Greycoat Research have learned about how this common supplement might actually be helping these little guys.
It all started fairly simply. We provided a melatonin guide, just some basic info, to 2 animal hospitals. They were working with about, I think it was 11 cats, all diagnosed with kidney disease. The initial idea was just, well, could melatonin maybe help with their anemia?
Right, a bit of an exploratory thing.
Precisely. But then the feedback started coming in, and it wasn't quite what we expected.
Oh, how so?
The hospitals reported that some cats, the ones whose anemia just wasn't budging even with standard erythropoietin injections.
Yeah, the hormone that stimulates red blood cell production.
That's the one. Well, these resistant cats actually showed an improvement in their red blood cell counts once melatonin was added to their regime.
Whoa, okay, so adding melatonin made a difference when the main treatment wasn't enough.
That's what it looked like. And that, that really made us lean in and look closer.
So how could melatonin, the sleep hormone, possibly be boosting red blood cells?
Well, our research at Greycoat points to maybe a couple of mechanisms. It's not just about sleep.
Okay.
First, it seems melatonin might directly stimulate the bone marrow, sort of encourages it to produce more red blood cells.
Like a little production boost.
Kind of, yeah. And second, there's evidence melatonin has anti-inflammatory effects, since chronic inflammation often plays a role in the anemia associated with kidney disease.
Reducing that inflammation could also help. Makes sense.
It potentially tackles the problem from 2 angles.
Do you have, like, a specific example from the Greycoat research findings?
We do. There was one case, a cat we're calling Jay, 4-kilogram cat, stage 3 kidney disease. And Jay's hematocrit, which measures red blood cells, was down at 13.2%. Really low.
Ooh, that's dangerously anemic.
Very. And Jay had already been through the usual treatments, iron supplements, those erythropoietin injections. No significant improvement. They even did a blood transfusion, but the levels just dropped again afterward. It was, well, pretty disheartening.
Gosh, you can imagine how worried the owners must have been. So what changed?
Well, after getting Jay's blood chemistry a bit more stable, particularly the acidosis, the vets decided to continue the erythropoietin, but also add melatonin into the mix.
Okay, so melatonin plus the standard injection.
Exactly.
Yeah.
And here's the really striking part. After about 4 weeks of this combination, Jay's hematocrit returned to the normal range.
No kidding. From 13% back to normal.
Back to normal is quite a turnaround.
That's incredible. But was it just the numbers, or did Jay seem better too?
Oh, absolutely the latter.
Yeah.
That's just as important, right? Jay started eating much better, became more active, was even climbing the cat tree again, things the owners hadn't seen in a while.
That's fantastic. That's the quality of life improvement you hope for.
And interestingly, Jay is currently maintaining a stable condition without needing further erythropoietin injections, just the melatonin and other supportive care.
Wow. So based on Jay and the other observations from Greycoat research, when might this be something to consider?
Our feeling is it's worth thinking about when a cat with kidney disease develops anemia, especially if that anemia isn't responding well to the standard erythropoietin, or even just when the cat's overall condition seems to be going downhill.
Sort of like an additional support tool.
Exactly, a supportive aid.
And the crucial question, always, safety. Any side effects noted in these cases?
That's always paramount. Melatonin has a very short half-life in the blood, meaning it doesn't hang around for long. And in the cases we observed through Greycoat research, no adverse side effects were reported.
That's really positive.
It is very encouraging.
So the bottom line from Greycoat research seems to be, well, fairly straightforward.
Pretty much. Our conclusion, based on these observations, is that if a cat with kidney disease is facing declining health or recurring anemia, especially if other treatments aren't fully working, there's really no obvious reason not to try melatonin as a supportive measure.
No reason not to try it. Okay.
Given its apparent safety profile in these instances and the potential benefits we saw, it seems like a reasonable option to discuss with your vet.
So wrapping up this deep dive, the key takeaway from Greycoat research is that melatonin, surprisingly, might offer a promising helping hand for cats with kidney disease. not just for sleep, but potentially for managing anemia and improving their overall well-being.
Particularly when the standard approaches need a bit of a boost. It opens up another avenue for support.
Absolutely. And thinking about this, based on what Greycoat research found here, it really makes you wonder what other common supplements might have these unexpected beneficial roles in keeping our pets healthy.
That's a great question. Definitely something worth exploring further.
Food for thought indeed. Well, thanks for joining us for this deep dive brought to you by Greycoat Research.
Thank you. And you can find more information on the Greycoat Research website.